So I just want to say welcome to our prospective students that are attending this virtual open house to learn a little bit more about Winona State University's graduate programs in nursing. Today we are going to cover some basic information about our AGCNS program, our Nurse Educator program, and then our 2 nursing leadership programs. So the agenda for this afternoon is going to go fast. I'll just do some quick introductions of our WSU faculty and staff that are joining us this afternoon. And then Dr. Prakna will cover some basic information about the CNS, NE, NOL, and PLI programs. And then Sammy Eckerson will be reviewing some of the admissions process. And then Dr. Poncho will cover some frequently asked questions we get from students. And then we actually do have 2 current students that are joining us this afternoon to share a little bit about their experience. And then of course, we want to have time at the end to answer any questions that you may have. So again, welcome. My name is Misa Borman. I'm the Clinical Placement Coordinator. Sammy Eckerson is on with us this afternoon. She's our Recruitment and Admissions Advisor. Dr. Forsyth is our Nurse Educator Program Coordinator. And then Patty Gangle is our Office Administrative Assistant. And then Dr. Poncho is our AGCNS Program Coordinator and wrapping up her duties as the Acting Director for our graduate programs in nursing. And then Jen Prakna is also with us, and she is our Nursing Leadership Program Coordinator. So with that said, I'm going to pass the baton off to Dr. Prakna, who's going to give you an overview of our programs today.
Hi everyone, welcome. It's great to be here with you today. So we are actually just going to present 4 of our program options today. We actually have 7 graduate nursing programs, but we're just going to go through the 4 today of the Adult Gero CNS program, the Nurse Educator, and then 2 leadership programs, which is the Nursing and Organizational Leadership and Practice and Leadership Innovations. We do have 3 program pathways, Master's, Graduate Certificate, and Doctor of Nursing Practice, which the DMP can either be a BSN to DMP or can be an MSN to DMP. We do have our student handbook too on our website. That's very helpful when you want to look at the different plans of study, what are the different programs, the requirements, what are some of the things that we hope you achieve over that time as well. So let's look at each of these programs a little bit in more depth. So the master's and the graduate certificate program. So a graduate certificate is a certificate that you would get if you have a master's degree already and you're coming back maybe for a different specialization, a master's degree in a different specialization. But you come in with credits and some other experience and skills that you can apply to a new degree or a new certificate. So the Master's and Graduate Certificate program is really designed to make sure that you are very skilled in looking at the evidence and appraising that evidence and using that evidence to make change, whether it be on a unit level or with families, or perhaps you're in a position where you're looking at a systems level or a cluster of units. Whatever the case may be, we want you to come out with those skills to be able to apply that research, ethics, the sciences, thinking about things like culturally competent care that can really change maybe our approach for different populations and systems. Also, of course, leadership is very important. And working with interprofessional teams is really how healthcare has evolved over the decades. And so we know that that's important and we want you to have those skills as well. Quality and safety is always at the forefront of what we do as well. So that's why we use evidence to drive what we do. Our DMP programs are really made to take you to that next level. So you've created a base with maybe a master's degree or a bachelor's degree, and we want you to become a change agent that is effective in appraising the evidence and applying that again to different populations. And notice how some of the same things we hope that you'll achieve in your DMP that maybe you achieve in a master's degree, such as delivering culturally competent care, because that's important for our populations that we care for and the healthcare systems that we're in. Again, professionalism and leadership strategies are another common kind of element that we really like to see in our DMP programs and what we hope that you come out with at the end. Also, we're taking your knowledge a little bit further and really synthesizing all of the knowledge that you have or that you've gained and working with others in an interprofessional team to really make very sound decisions about how you're going to move forward with making changes either at the individual or system or population level. So just really a step further and higher thinking definitely in our DMP programs. So here's a little bit more information about each of the programs that we're presenting on today. So you see the adult Gerontological nurse specialist there, which students are prepared for the multifaceted role of a CNS. And you will be doing direct care, consultation, learning about systems leadership. And remember that collaboration and interprofessional teams, that's very important. Coaching and research competencies are also important. For the nurse educator program, we really want to prepare students to teach in an academic or a healthcare setting with a focus on teaching and learning. So learning those best practices within that kind of an environment. And then the two leadership programs, Nursing and Organizational Leadership and Practice and Leadership Innovations. The NOL program is really designed to help students who want to be in that formal administrative leadership role. And how can they best perform in that role? Also, the Practice and Leadership Innovations prepares you to be a leader in whatever setting you may be in. And you may not be a formal leader, but maybe you're an informal leader in your group. And so this track really prepares you for that. The master's programs offer 2-year, full-time, or 3-year, which is a part-time plan of study. There are different credit requirements for each of the degrees, as well as different clinical hours. So you can see the differences there between the nurse educator and the NOL program. For a graduate certificate, we have a CNS, which is 16 credits total. You can see the clinical hours there. The nurse educator graduate certificate is 12 credits. That includes 180 clinical hours. And then the nursing and organizational leadership is also offered as a graduate certificate, which is 24 credits with 360 total clinical hours. And then our DMP programs. These are offered as a 3-year or 4-year part-time plans of study. So this is looking at a BSN to a DMP. So these are the total credits for that. You can see the differences in maybe the different clinical hours, but they all require 72 total credits. And the DMP actually requires 1,000 hours through of course, our accreditation bodies. And so we definitely have that in our programs and even a little bit more. And then for the postmaster's DMP, or what we have called the advanced placement DMP. So these are students that come in with a master's degree and they can go into one of these tracks from the master's to the DMP. All of them are 31 total credits. They have varying hours. You can bring in hours, of course, from your master's degree to get you to this point, and then we provide the additional hours to get you to that 1,000 hours that are required for the DMP degree. And you can see the different clinical hours that are required in each of those. And this is just a really nice snapshot of the different programs that we're talking about today, the clinical experiences that you might have in each of these programs and the number of clinical hours that are required. We do have Misan. You've met Misan. She's started off our presentation today, who's our clinical placement coordinator. She works with the faculty and the students to make sure that you're getting the experience that you want and that you need to be able to be effective in your future role.
Yeah, thanks, Dr. Procknell, for helping facilitate that information. And then Sammy is going to work with us to just kind of give you a little overview of our admissions process.
Wonderful, thank you. So In our admissions process, there are definitely 3 different tracks. If you are an international student, we have you first apply to the Graduate Studies office. If English is not your first language, we do have you then fill out the TOEFL or the IELTS and work with the International Student Office. And then we have you go on to fill out the Graduate Programs in Nursing application, which is through the Nursing CAS. We do have an option too for students who are current WCU nursing students, and this is only for our current students right now. And they are eligible to start a graduate nursing pathway. And I would like you to speak to your current advisor, and you can cross over and take graduate nursing courses. But this is only for our current RN-to-BS or nursing program students. And we would like you to determine that eligibility as of right now. But this is an amazing program for our current students to start taking classes. So for all of our general application or applicants, you would apply to the WCU Graduate Studies office, and we would need your official transcripts at this point. Then you would go on and actually apply to the Graduate Programs in Nursing office and through the Graduate CAS. So this opens August 15th and for a fall 2021 start, and they would need your unofficial transcripts. So here's another way to look at it in the steps. You first apply to Winona State Graduate Studies, and this is an online application. So that would be your step 1, right? Step 2 would pay your $20. If you actually apply next week, that $20 fee is waived. So you'd be saving some money in that way. Then you send all of your official transcripts to Graduate Studies. You can either mail them in or you can send them electronically to the grad office at winona.edu. And then you apply to your program, which is where you would apply to the nursing CAS. So then you would watch for your admissions decision. So if you are, thinking maybe I want to try a few classes out first before I officially decide if I want to, be admitted to the school or not, we have a really great way for you to try out a few classes, and they are graduate special classes or just some classes that you are able to take. So there is a rule within Graduate Studies that you can take up to 12 graduate credits before you're actually admitted into the program. And those are, right now, they're called graduate special credits. And there's a list right now on the graduate nursing website. And you can talk to the graduate nursing department about what those classes are, and we can get you admitted exactly the same way. So you go through and apply to Graduate Studies, pay the $20, submit your transcripts, and get all of those things into the Graduate Studies office, and then we will help you take those courses, right? You could even just take one course, just to see what it would be like. So, and that is basically how, and all of those credits transfer into the graduate programs in nursing. So any credits that you are, or any questions that you have, just let us know. Otherwise, that's basically the admissions process.
So thanks so much, Sammy. I'm actually going to pass the baton off to Dr. Poncho, who's going to talk through some of the most frequently asked questions that we get from prospective students.
All right, thank you, Misan. So one question we often get is how are our applications to our programs scored? And so we use a combination of a grade point average, professional community experiences, any certifications that applicants might have, previous publications or awards. We also request references, and those ratings are used in the scoring, and the performance on a goal statement that we request that addresses a number of areas we're interested in, and community service. Applicants also ask then, based on that, what would improve their chances of being accepted into one of the graduate programs. And so you'll want to put your best foot forward in your application to maximize your scores. And so, thinking about improving your scores in any of those areas, in terms of your professional community experiences, publications, awards, all of those areas are opportunities for improvement. And then applicants who score high enough on that initial application through our electronic nursing CAS, then will be invited to have an interview. And so we encourage applicants to prepare for an interview just like you might prepare for a job interview. And then another common question on the next slide is if students can work while they're completing the graduate program in nursing. And most of our students do work to some degree. Students will often work part-time through the program. So for example, if you do a 4-year plan of study, the first year will include some core courses, foundational courses for the role and population focus of your program. And often during those initial years, students might work as much as half to 3/4 FTE. Sometimes students work more than that, sort of depending on their job schedule. And then in the final year of the program is when students will do their role clinical or practicum. And that is really quite full-time. So often students will decrease their work appointment during that last year, but at least that gives you some time to prepare for that. We say that students need to you can expect to complete about 4 to 5 hours outside of the classroom per credit per week. So that gives you some idea of the workload that we expect as instructors and faculty. So that time might be spent on preparatory readings or assignments or writing papers or studying for exam, but again, about 3 or 4 to 5 hours outside the classroom per credit per week. And then we also want applicants to understand that 1 credit of clinical equals 60 hours of clinical time. So when you look at the clinical courses in your role and population focus, you can determine how many hours then you will be in clinical during that semester. And we we kind of discourage changing employers during your time as a student, although we also know that that happens and it's not impossible, but that does have an impact on your clinical placements. We're finding that many clinical partners are prioritizing their own employees first and then others as they have space available for precepting and accepting other students. So if there is a need or an opportunity to change employers during graduate school, we just request that you give us as much advance notice as we can because Nissan does work quite a bit ahead in terms of those clinical placements. So we talked a little bit about transfer credits. Sammy gave a little bit of information there. And so again, students can transfer a limited number of credits into the program from an outside institution. And we have more details in our student handbook. We do allow a few more credits if those transfer courses are from a Minnesota State graduate program than if they're from a school that's outside Minnesota State. And then another question we commonly get is about clinical placements and who's responsible for setting up those placements. And as was mentioned, we have a clinical placement coordinator, Dr. Misan Borman, who works with the program faculty, ourselves, and students in finding appropriate clinical experiences for the variety of clinical courses that we offer. So we submit those requests well in advance and then assist students in navigating the many site-specific onboarding requirements. And so we keep track of those changes and updates and communicate that to the students accordingly. If a student has any leads or connections that they may have to potential preceptors, we ask that you communicate that to your faculty, your academic advisor, and Misan. But we really coordinate all of the placements and communications to our clinical partners through our clinical placement coordinator, and often the agency clinical placement representative too. So we really don't want students directly communicating with a clinical site or preceptor unless we've given that permission to do that. And that's something that our clinical partners have requested of us. So we're really working hard to get our relationships with our clinical partners in a working relationship, and communication methods that work for all involved. So we do take that responsibility off students' shoulders, and really have great relationships with our community partners. And then a common question is how much of the programs are online and how much require coming to campus. And so it really kind of varies a bit by program. Most of our foundational core courses are available either synchronous or asynchronous online or distance delivery. And so that's true of all of our 4 programs. For the AGCNS, students can take either the on-campus or the distance delivery core courses, but at the point where we get into the APRN role, we have on-campus delivery. And for the NE courses, the courses are planned as hybrid, so limited time on campus, except for our 619 or health assessment course, which does require on-campus activity for our lab, and we're managing that even despite COVID. And then for the NOL and PLI programs, those have options for distance delivery. So there are often synchronous sessions, and we're holding those via Zoom often. And for those programs, you just need to meet and work with your academic advisor to make sure that you're taking the right courses the right semester, because most of our courses have both a face-to-face on-campus version and a synchronous or asynchronous online version, and so your academic advisor can help you find the right semesters that the courses are offered in the delivery method that you prefer. Then in terms of the cost of the program, of course, we're all very concerned about rising tuition rates and keeping our tuition in a manageable amount. And so the tuition rates for 2021 aren't out yet. Those are dependent on actions of the legislature. So you can take a look at our 2019-2020 rates that are available on the website listed here. And those 2021 rates should be coming out soon, as soon as our legislature and system make those available. And then we often have a question about out-of-state tuition, and all of our programs, all of the students in the various programs pay the same rate regardless of geographic location. I think those are all of the common questions. So with that, we'll turn over to the student panel.
Yes, thanks, Dr. Poncho. So we do have 2 current students with us. So Laura Johnson is in our Nurse Educator program, and then Rachel Kantz is in our Nursing Leadership program. So I will start with you, Laura. If you want to introduce yourself, maybe just give a quick overview or overall of what your experience has been like as a student. And then if you have any tips, suggestions for new applicants, and then we'll have Rachel follow you.
Great. Hello, thank you for having me. My name is Laura Johnson, and I'm a graduate nursing student at Winona State University, Rochester. And as Dr. Borman mentioned, I'm in the Nurse Educator program. I began as a graduate special student, and I've taken it at my own pace. And I think it was a great way for me to begin graduate school. And I encourage you, especially if you're not exactly sure which area of study you'd like to go into, I think it's a great way to enter into graduate studies. And I plan to graduate in the spring of 2021. As far as my experience at Winona State, it's been very positive. I've been impressed by the flexibility of the graduate curriculum And I appreciate that courses are offered in a variety of formats, face-to-face, hybrid, or online. And I think that the coursework is highly rigorous and the nursing faculty are well credentialed and experientially qualified. And I've really appreciated that. And just a note of being in spring semester last semester in the wake of COVID, I was really impressed by how Winona State Rochester really seamlessly transitioned into an online delivery. My thesis group and I were able to defend our thesis virtually and complete our project on time despite this challenge. So I was really impressed by that. And then just a note of, I think my biggest tip for anyone planning to enter into graduate studies is to really take care of yourself. I think work-life balance is key. And consider starting with 1 or 2 classes. I know you want to just jump right in and get going, but I would say really try to pace yourself and know that, you know, the work will get done. But I think if you overload yourself, it can be really overwhelming. So welcome, and wish you well in your graduate studies.
Thank you so much, Laura. Rachel, do you want to share some of your thoughts?
Yeah, sure can. My name is Rachel Cans. I'm a DNP PLI program. I'm in the DNP PLI program. I started out here actually just finishing up my BSN. So I went to the ADN to BSN course path in La Crescent. And as I was there, Dr. Foote at the time was explaining the graduate program. So I sat there and I just listened to what she had to say, and I was absolutely sold. She mentioned that there were a few different programs, and I knew that I was interested in possibly teaching or maybe doing some leadership options. And when I reviewed the PLI program, I knew that that was the right program for me. I would say the BSN, being in the BSN program, the bridge program that they offer at Winona State, that actually sold me on continuing to invest in my education at Winona State University. So I think that that for me was a defining moment and where I was going to continue my path. They have been wonderful for me. The entire graduate nursing program in Rochester, I have been remote most of the time, and I have not felt that I have been distant from the staff or the faculty or the administrative assistant staff there at all. So I think they do a great job of working with you regardless if you're physically there or not. I am unique in the fact that I only go there usually my first week of courses. I actually live in Winona, and I go to Maxwell, and I do my hybrid courses every 4 weeks, and I meet online there. It has been extremely smooth for me. And I feel like the non-traditional student is kind of what they made this program for. You could have, essentially, you could be from any realm of practice or whatever you'd want to do to pursue in the future, but it really wouldn't matter because I feel like they customize your experience for what you need it for. I'll be starting my 3rd year of my DNP PLI. I am going to go until the 4th year. I'll finish in May of 2022. As of now, that's my plan. Overall, like I had said before, I think that they tailor the programs to what you need. Most importantly, I think what Laura said about doing the graduate studies program, I did not partake in that, but I felt like I got a great experience with the BSN, so I kind of knew where I wanted to be because I was preparing to go into something else. And I have had a couple of friends do the graduate studies and had a wonderful experience, and then have went on to apply and gotten in. So I think that's wonderful that we offer that. And also, I've had a lot of chances to meet other graduate students that are going into many different fields. So I feel like in my 2 years in my graduate program, I've had different thoughts and different directions that I've pushed my own career into just based off of the experiences I've had with other students and with my faculty that I've had. So I think that you get a lot out of this program, more than just the academic piece of it. I think it really prepares you for a career path that you want. The tips and suggestions, actually the biggest one for me, which I got at the end of my BSN when I knew I wanted to go on, I found a mentor. It was a faculty member, actually a professor of mine in a leadership course, and she and I have talked, I would say, every three to 4 months, and we have meetings together. She has helped me with my thoughts on my DMP project. She has been a wonderful advocate for me to bounce ideas off of, and just to keep me accountable and keep me on the right path with what I'm trying to do. And I think that that is probably the most beneficial piece that I've gotten since I've been in school.
Thank you so much, Rachel. Those are some really great insights. And then I also want to just mention again, for contact purposes, on the screen, if you can see it, I have the key contacts to follow up with if you have additional questions. Our Office of Graduate Programs in Nursing. You can see it's gradnursing@winona.edu. And then our Office of Graduate Studies, which is gradoffice@winona.edu. If you have any questions, don't hesitate to reach out to us. Well, this pretty much wraps up our virtual open house for our CNS, NE, and our 2 nursing leadership programs. And again, we thank you for your time, and we look forward to seeing your applications come through. Have a great day, everyone.